Hi, my name is Devin Chandler. I'm a Sports Medicine 3 student, and I decided to do my sixth project on sleep disorders and how to treat them. So, the three different disorders we'll be going over include sleep insomnia, which makes it hard for someone to fall asleep and stay asleep, sleep apnea, which is a disorder where one's breathing repeatedly stops and starts, and it can make someone feel tired even after a full night of sleep, and narcolepsy, which is a fairly common condition that makes it hard for one to stay awake and often find themselves tired. So, what is sleep insomnia? Sleep insomnia is a very common sleep disorder that makes it hard for one to fall asleep and stay asleep, and it can be chronic or acute and lasts from one night to 3 months or more. There are two different types of sleep insomnia, primary insomnia and secondary insomnia. Primary insomnia causes include stress, changes in the sleep schedule, and the environment, and secondary insomnia causes include mental health, medications, pain or discomfort, and other sleep disorders. Symptoms of sleep insomnia include tiredness during the day, fatigue, problems with concentration, and grumpiness. So, how do you treat sleep insomnia? After being diagnosed with sleep insomnia, a doctor may prescribe sleeping pills for a short period of time, some of which include temazepam, triazolam, and Zalplan. Although these may help temporarily, it's best to seek cognitive behavioral therapy for better long-term effects. In order to prevent sleep insomnia, it's important to develop proper sleeping habits, avoid blue lights before bed, including phones, televisions, etc., avoid caffeine, and get regular exercises. So, what is sleep apnea? Sleep apnea often occurs in males, overweight people, and people over 40. It's a condition where someone's breathing repeatedly stops and starts. Usually, someone will feel tired after a full night of sleep with sleep apnea. The three different types include obstructive sleep apnea, central sleep apnea, and complex sleep apnea, which is just a combination of the two, obstructive and central. The obstructive sleep apnea causes the muscles in the back of your throat relax, causing the airway to narrow as you breathe. This makes the brain believe you're not able to breathe, awaking it from its sleep to reopen the airway. Central sleep apnea causes include so what happens is the brain is unable to transmit signals to the breathing muscles, and then you're not able to breathe. So, after being diagnosed with sleep apnea, a doctor may suggest simple lifestyle changes such as losing weight, quitting smoking or vaping, and allergy treatments. But if you're still seeing moderate to severe signs of sleep apnea, breathing devices can help open the blocked airway, some of which include CPAP, which is a machine that provides air through a mask worn over the nose, oral appliances, which open the airway by bringing the jaw forward, ASV, otherwise known as adaptive servo ventilation. It's a computer that learns your breathing patterns and uses pressure to help normalize the breathing. So, narcolepsy is a sleep disorder that causes daytime drowsiness and tiredness, along with the sudden urge to sleep. Common symptoms include sleep paralysis, daytime sleepiness, cataplexy, which is the sudden loss of muscle tone. Although the exact cause of narcolepsy is unknown, doctors assume it's related to autoimmune reaction. People with narcolepsy also show low levels of hypocretin. If you have a family member who was previously diagnosed with narcolepsy, your risk is 20 to 40 times higher. Narcolepsy is often found in people ages 10 to 30 years old. As for the treatment for narcolepsy, there's currently no cure, but certain changes in medications may help manage it, some of which include medications such as stimulants and serotonin inhibitors. And although these medications can help get rid of symptoms, it's also important to make some changes to your everyday lifestyle, such as taking naps, sticking to a schedule, getting regular exercise, and avoiding nicotine and alcohol. Thank you.